Hi, Doc Mike here. Living with osteoarthritis can be a challenge, especially when it comes to maintaining an active lifestyle. The pain, stiffness, and limited mobility associated with the condition can make exercise seem daunting. Although it may seem counterintuitive, exercise can actually help with the symptoms of osteoarthritis and with joint health. For more information on the benefits of exercise in osteoarthritis, please check out my article on the benefits of exercise for arthritis at theexercisedoc.com. Today, I'm going to go over an exercise program that will benefit people with arthritis. The first step in your exercise program is getting cardio. Cardio will help burn calories to help maintain weight. It'll help your heart, and it also will help with mobility. So put on your walking shoes, or get an elliptical, use an exercise bike, swim, or do water rollers. Next, we move on to flexibility. Start with the neck by bending forward gently, then leaning your head back gently, looking over your left shoulder, then your right shoulder. Try to touch your ear to your right shoulder, and then your left shoulder. Now move on to the shoulders. Pull your left shoulder across your body and hold it until you feel a stretch in the shoulder joint. Now switch sides. Now move on to shoulder circles. Initially, circles to the back, and then switch circles to the front. Now move on to shoulder sweeps. Point your thumbs up, sweep your arm behind you. When you're halfway done, rotate so that your thumb is pointing the other direction. Alternate shoulders. Now do shoulder slides. You can do this against a wall or on the floor. Pull your shoulder blades together and try to keep your hands in contact to the wall or the floor. Slide your arms and shoulders up and down the wall. Now move on to the wrists. Clasp your hands together and do figure eights to loosen up the wrists. Now put your arm in front of you and gently pull your palm back. Make sure you do both hands. Now slowly raise your arms up overhead, bend backwards, and look up. Feel the stretch in your abdomen and your back. Gently fold forward, hinging at the hips. Do not bend the back. Keep the back flat. Sitting in a chair, gently twist to the right. Slowly increase the stretch. Now switch sides. Now cross your right leg over your left at the ankle. Gently push down on the knee and lean forward. You should feel a stretch in the hip and buttock area. Now switch sides. The first strength exercise is the elevated push-up. Lean against a wall or chair. Breathe in as you go down. Breathe out as you push up. Next, do squats. Breathe in as you go down, out as you raise back up. Try to go down as far as you can. If you have trouble, you can use a chair and sit, stand. Next is the lunge. Step forward with one leg, lower yourself, and push yourself back up as you step back. Side lunge is similar, except you step to the side instead of stepping forward. Make sure you do both sides. Hold a towel overhead at shoulder width. Pull the towel apart as you actively pull the towel down. Breathe in as you raise the towel, out as you lower the towel. You should feel this in your upper back. Now do calf raises. If need be, you can hold on to a chair for your balance. For all of the strengthening exercises, aim for 10 to 15 reps per side. The last aspect of fitness that people with arthritis need to worry about is balance. When you have arthritis, the joints are stiff and painful. They don't work that well. As a result, you have decreased mobility. As a result of that, most people are inactive. They develop muscle weakness. Now, I've already talked about several exercises that are beneficial for your balance. Squats and lunges work your leg muscles and your hip muscles. It can be great for balance. Calf raises also can help with balance. I'm going to talk about 2 other exercises and give you demonstrations right now. And this should complete your balance training. The first balance exercise is standing on one foot. Initially, you may need to hold on to a chair, but as you progress, you should be able to do it without a chair. As you get better, start moving your arms in different planes to challenge your balance. Next, walk heel to toe along a straight line. This is not as simple as it looks and can be very challenging, but practice does help. Okay, so that's a reasonable program for somebody with moderate arthritis. If you're interested, please check out my video on walking for exercise. Also, as you get more into exercise, I have videos on body weight exercises, using exercise machines, and using free weights. Also check out my video on the proper warm-up and a video on flexibility. I also have a video specific for people with back pain. If you have severe arthritis, don't despair. Stay tuned because I'm going to be having a special guest who teaches chair yoga and chair exercises at several senior living facilities. So look for videos on those 2 topics. When you're doing exercise with arthritis, just remember, slow progress is progress. This is Doc Mike saying, I'll see you next time.